Hi, my name is Dr. April Morrison. I am one of the faculty members here at East Tennessee State University, and today I'm just going to be talking about the complete blood count, or the CBC. As a new healthcare provider, I think it's intimidating a lot of times to order labs because then you have to know what to do with the labs. But what I'm going to do is just try to help us have a better understanding about the basics of what a CBC is, and then even maybe what we can do with the information that we get on the patient. Before we get started, let's just see what even is a CBC, or complete blood count. Essentially, I want you guys to understand we're actually looking at three basic cells: the white blood cells, red blood cells, and the platelets. Everything else on your CBC really tells you about the condition or the health of those cells. So keep that in mind. So WBC, RBC, and platelets. Those are the main cells that are circulating throughout our body, and oftentimes on a CBC, these are calculated using an automated instrument. However, there are instances in which that will need to be done manually, and we can talk about that a little bit more later. So remember, this is an automated machine. So what can we learn from a CBC? There are a lot of things that we can learn. Iron deficiency anemia, inflammatory diseases like rheumatoid arthritis. You can even see, an elevated white blood cell count with a rheumatic process. Vitamin B12 deficiency, folate, HIV, cancer infection, and even some kidney disease can be found when we look on a CBC. So there's a lot. This is a very valuable test. What exactly are we looking at when we look at each of these individual cells? A white blood cell, many of us know it's infection. However, it's also looking at inflammation. These are the cells in our body that actually identify the infection. Now, there's a CBC without differential, and then there's one with differential. I'm only going to be talking about the CBC without. When we're looking at a CBC with differential, we're looking more specifically at the white blood cell count, which we won't be doing today, but just know that a CBC with differential really only needs to be looked at when you're looking at things pertaining to white blood cells. The red blood cell count, again, this is one of those main blood cells floating in our stream. The hemoglobin, this is actually a protein in the red blood cell itself. Think of heme meaning color. This is what actually gives its red color to the red blood cell. If we're looking at a hematocrit, this is actually a percentage of our blood that's actually made up of these red blood cells. Mean corpuscular volume, when you hear the word volume, think of size, okay? So we want to make sure that our red blood cells are going to have a good size, or a good volume. Mean corpuscular hemoglobin, again, hemoglobin means red. It's the amount of hemoglobin that is actually in the red blood cell. Mean corpuscular hemoglobin concentration. This just says, hey, do those red blood cells have enough hemoglobin in each one? Looking at the red cell distribution width, again, width meaning size. So what is the variation in our size? Is there a lot of really small red blood cells? Is there a lot of really big red blood cells? Oftentimes, if we have a lot of really big red blood cells, those are oftentimes those brand new ones that the bone marrow is kind of cranking out. Platelet count, this is talking about thrombocytes, and oftentimes this is most closely associated with blood clotting. And then when we look at the mean platelet volume, again, volume, think size. What is the average number of platelets in the blood volume itself? So based on each of these, what can we learn from our CBC if we have maybe an abnormal in any of these areas? Now these can be up or down, so if you have an elevated or a decreased white blood cell count or a red blood cell count. So white blood cell, oftentimes, again, infection or inflammation, it can actually look and you'd be used to diagnose cancer or maybe even allergies, because a lot of times allergies can either cause an infection or there can be an inflammatory process going along with that allergy. Red blood cells, all kinds of anemias that can be distinguished based on either high or low value. The hemoglobin, we can actually look at various lung diseases like COPD, emphysema, hypoxia, and again, anemias. The crit, again, anemias and other lung diseases, and even kidney disease, because we know that erythropoietin is created by the kidney. And if the kidney is damaged, that erythropoietin is not going to be excreted as it should. And the erythropoietin is what stimulates the bone marrow to produce more cells. The MCV, again, think volume. So again, we can look at things like anemias or even other malignancies or maybe a malabsorption disorder. Perhaps somebody has celiacs or Crohn's and they do not do a good job at absorbing the nutrients that they're taking PO. Mean corpuscular hemoglobin, again, a malabsorptive disorder or other anemias. And then again, the MCHC and the RDW, they kind of tell you a picture of how bad is this anemia. How long-standing is it? Platelet count, those can be up or down based on whether you have lupus, maybe even mono, cirrhosis of the liver, thrombocytopenia, or thrombocytosis. So maybe you're clotting too much or maybe even not enough. And then our MPV, that can indicate things like spleen disorders, an inflammatory bowel problem, or even cancer. We really don't use these a whole lot, but this is just a quick way to look at your CBC to tell if there is something abnormal or normal. You can just simply draw out this simple picture, and it's something that honestly I did a lot as a nurse working in the hospital, but it's just a little bit of information here for you today. One of the values of having this is the more and more you do it, the more and more you'll recognize as abnormal values. So when do we order a complete blood count? Well, surprisingly, according to the evidence, is really only one age point at which we do this, and that is at their first birthday. Children, when they're in utero, are developing iron stores within their body. However, by about 6 months, those iron stores will begin to diminish. So we want to make sure that when they begin their foods, they're starting higher iron foods so that by their first birthday, they're not anemic. However, we will begin to check that at their first birthday. You can actually assess for iron deficiency before then and check it before then if need be. However, if you do have a child who's maybe borderline at the first year of age, you can actually screen for it again and maybe even repeat it at 24 months, which I do. And sometimes you also have to look at the insurance because insurance does not always go by the guidelines, so that is something you'll need to kind of check on a patient-by-patient basis. Otherwise, if you are a non-pregnant, asymptomatic adult or teen, there's really no reason for us to be checking a CBC. So unless you are pregnant, that is a reason why we would want to. So, what is going to alert you to check a CBC? There's a lot of things. A patient may complain of fatigue, weakness, maybe they're getting shortness of breath on exertion, complaining of lightheadedness or maybe even syncope or near syncope, itching of their skin, pruritus, they may even have some bloody stool. That'd be a great indication. Having heavy menses, maybe they've had recent trauma, perhaps they were in a car accident and they're having profound abdominal pain. Maybe there's some type of an internal organ damage, maybe a spleen or a liver lack. And then if they're pale, that would be a great reason. And then pale doesn't necessarily have to be in the face. It can be pale mucous membranes. It could be pale lips, any of those things. So one thing we need to understand is anemia is a sign of a disease. It is not a disease. If you ever see anemia, it is not normal and it needs to be investigated. Primarily when we're looking for a CBC indicator of anemia, we're looking at 3 primary values, and that's our hemoglobin, our hematocrit, and our red blood cells. So let's look at this patient here today. Based on those 3 values, our patient today had the following lab work. What is it that we see? Well, based on what I see a low hemoglobin, I'm seeing a low hematocrit, and everything else, I think, seems to be within normal limits. So is this patient anemic? Yes, they are. They do have some form of anemia because remember those 3 indicators, hemoglobin and hematocrit, and the red blood cell, those are the 3 indicators. If any of those are low, there is some type of an anemia going on and it's never normal. So, I want us to think about what exactly are the responsibilities of each of these values. So the hemoglobin, remember, gives us our color. However, think about it in this way. It is a protein that is responsible for the oxygen delivery to our tissues. So think about this as being a car. This is the actual vehicle where we get the O2 to the tissue. Hematocrit, think about passengers within the car. So the volume or the percentage of red blood cells compared to everything else within the body, all those other red blood cells. So think hemoglobin, car, hematocrit, passengers. The volume, think about the size of this red blood cells. Is it microcytic, so it's small, normo, so it's a good color, or macrocytic, is it huge? Think about the volume or the mean corpuscular hemoglobin, excuse me, think about color. Is it hypochromic, so it's a pale color, pale pink, or is it nomochromic, it's a good red color, or maybe it's hyperchromic, it's like beefy red. So again, think about heme meaning iron. When we look at this RDW, the degree of distribution, we do not want this distribution width to be greater than 15%. Anything less than 15% is considered normal. All right. We have a 51-year-old female who presents to the office today complaining of fatigue, lightheadedness, and shortness of breath on exertion. She says it has been happening for about the last 2 months, and she thinks she may be going through menopause because she's having some irregular menses. For example, she'll say she'll have menstruation for about 2 to 3 weeks, and then she'll skip a couple months. And now she's having, at the office today, some pale skin and the following vital signs. Looking at these vital signs just briefly, the only things that really catch my mind or my eye are blood pressure's, I mean, it's fine. It's just maybe a little bit on the lower end, and her heart rate's at the upper end of normal, and her respirations are also just a little bit high. So we do a CBC on this patient today because she did have some of those presenting symptoms indicating we might want to do some lab work on her. And the following is what we found. So white blood cells are normal. However, her red blood cells are low, so automatically know that she's anemic in some way. I don't necessarily know what that is just yet. Her hemoglobin, again, is low. Her hematocrit following suit. She is also low on her hematocrit. Looking at her MCV, so the volume, she has small little cells, it looks like. And her MCH, her hemoglobin, they're actually a fairly decent color. All these other labs are normal. So, what kind of anemia does she have? Now, I can't pinpoint exactly what kind of anemia that she has, but what I do know is if I can understand the red blood cell indices, I can go look up on a chart what type of anemia this may be in order to treat this patient effectively. So I know that she has low red blood cells, she's got microcytic hypochromic cells floating in her body, and she also has a decreased number of cars, so we're not getting a lot of oxygen delivery, which may account for some of the lower blood pressure and the higher respiration rate. And then she really has a poor number of passengers in her car. If you go on Google and you literally Google anemia's chart, it is going to delineate a chart for you based on the characteristics of the cells. Based on this patient today, the presenting history, her indices that we see, and based on that chart, we can identify this patient as having iron deficiency anemia, and perhaps this is what her skin may have looked like. Another case study. We've got a 51-year-old male who comes into your office today, very similar complaints, fatigue, lightheadedness, shortness of breath, and his symptoms have also occurred for about the last 2 months. He's actually been a 2-pack per day smoker now for nearly 40 years, but he noted that he had actually reduced his smoking to 4 cigarettes per day over the last week, probably because he can't breathe, and has no changes in his symptoms. He's flushed in his face and has nail bed clubbing. Again, vital signs look almost identical except for the blood pressure, and his O2 sat is just a little bit below what I would like it to be. So we go ahead and we do a CBC on our patient today. He doesn't seem to have an inflammatory or an infective process. However, he's got a lot of red blood cells, and his hemoglobin is elevated, as is his hematocrit. The MCV, or the size of this man's cells today, are actually fine, as is the color of his cells. Everything else seems to look okay on his red blood cell count. So what kind of anemia does he have? Well, I don't know the exact name of it yet, but I can definitely analyze the characteristics of his cells. So we know he has an elevated red blood cell count. We know that his cells have a good size, they have a fine color, but he has an elevated number of cars, or hemoglobin, and he has an elevated number of passengers riding in his cars. The name for this is actually called polycythemia. So poly meaning many, so there are a lot of cells floating around in this gentleman's body. Perhaps the reason for it is due to his extensive smoking history. You see, as we experience chronic hypoxia, this triggers the body to increase the production of erythropoietin within the kidneys. An increase in erythropoietin excretion is going to stimulate the body to make more red blood cells. Now, the reason for that is when we have hypoxia, the body is going to try to create a way to get more nutrients to the body. Since the lungs are not doing a very good job at increasing the oxygen flow to the rest of the tissues, the body says, hey, let's make more red blood cells in order to get more oxygen to the rest of the body. And that is all that I have for you today.